great pleasure that welcome David Laffan, Assistant Secretary of the Immunisation Access and Engagement Branch of the Department of Health, Disability and Ageing, and giving us a bit of an update on the 25 to 30 National Immunisation Strategy, how it will be implemented and how you'll be funding everyone. So we'll be all a lot happier with the money in our pocket and the better outcomes. So David, well.
Thanks very much, and thank you very much for inviting me to speak today. I grew up in Brisbane, so it is great to be back here. Although my dad's actually overseas at the moment, so I couldn't catch up with him for dinner, so that was a little bit inconvenient, but that's quite okay. I thought before diving into the immunisation strategy and its implementation plan, I'd provide a little bit of context on some of the way kind of immunisation, or give you a bit of a snapshot from a national perspective of immunisation. I will skip over a couple of the slides that have been prepared because it's been covered by some other speakers. But essentially, Australia has one of the most comprehensive national immunisation programs in the world. And since its launch in 1997, there's been significant progress in managing infectious disease. For example, even in the decade to 2015, rates of illness, disability, and early death from diseases covered by the NIP fell by about 30%. So that's really significant. And of course, other successes include the elimination of endemic measles in 2014. The NIP is free for populations most at risk of severe health outcomes. And the Commonwealth invests about $800 million a year, roughly, in the NIP. You can see at the bottom of the slide in front of you there, some of the responsibilities that split between the Commonwealth and the jurisdictions and the things that we do in relation to the NIP. Quickly, primary care clearly drives Australia's vaccination efforts. GPs administer, or in GP clinics administer, about 73% of NIP vaccines in the year to June 2025. And together with pharmacists, that rate is much higher, particularly in relation to COVID. COVID and GP clinics, about 97% coverage of all those that were administered. In terms of childhood vaccination, you can see, I don't expect you to be able to go through every line of the data that's there on the screen, but essentially it's just there to illustrate that there's a vast range of channels nationally. The bulk is delivered in GP clinics, but there are some jurisdictional differences through community health services, Aboriginal health services in the NT, and councils in both Victoria and South Australia also administer a significant number of vaccinations. There is clearly great concern, and Minister Butler is particularly concerned about falling childhood immunisation rates in the country. Everything in red there, which is below 90%, is of kind of particular concern. This is for for the 2-year-olds in particular, given the nature of the vaccines that are given there. So it's below 90% now for 2-year-olds, but even more, I think, concerning is that First Nations vaccination rates for 2-year-olds is now around 87%, so a little bit lower. The decline overall in childhood vaccinations is resulting in higher case numbers of disease. And to give you a bit of an example, pertussis outbreaks have been increasing in severity as the vaccination rates have declined. At around 94% a decade ago of pertussis coverage, an outbreak was usually less than about 2,000 cases. But that consistently, as the coverage now has fallen to around about 92%, the outbreaks are consistently between 3,000 and 5,000 cases. So there's a much higher burden of disease there. Vaccination across the lifespan is a focus of the NIP. So you can see some stats up there from the childhood vaccines like MMR, pneumococcal, and pertussis. They still have strong uptake above the average of 90%, which is great to see. Influenza and shingles are a little bit more mixed. Interestingly, influenza vaccines were delivered at a higher rate this year, slightly higher than the previous year, which is the first time that has risen since before the pandemic. So that was good to see. But still, again, while the rates were up for under 5 years old, for the general population, for over 65s, the coverage for flu this year was still lower for First Nations populations. You can also see there in relation to COVID that the general population rate is very, very low. Not a great deal of interest in the community in actually being vaccinated in relation to COVID. Some of the numbers there that you can see on screen were in Paul's presentation earlier. I would say the 6-monthly rate for the over 75s, getting those 2 a year, is kind of particularly challenging, and aged care providers regularly report there's that challenge because people don't want so many needles in their arms essentially, and they're particularly resistant to co-administration of flu and COVID vaccines. But we were able to get that 6-monthly rate up to just short of 60% this year on that sort of rolling basis through the winter season. And that was really quite significant because that was a good 10 percentage points higher this year than it was in the previous year. The department's done a lot of work with the Aged Care Quality and Safety Commission to boost those rates. And indeed, some of you might be aware that there's a new Aged Care Act commencing on the 1st of November, and that will take administration of vaccines in an aged care setting from something that's assessed as part of the quality of care principles into the offering of vaccines in that aged care setting is part of the accreditation process for an aged care provider. So it really strengthens the arrangements. And so that is for staff as well as the residents for the respiratory vaccines, flu and COVID, and also NIP eligible vaccines for the residents for shingles and pneumococcal. So hopefully we'll get, that will help boost the rates of those. Our challenge, there is obviously a challenge when it comes to the falling rates that we've been talking about. We do have pretty good data down to statistical area level 3. That SA3 is a pretty granular level of detail that we're able to get. You can see on the slide there's about 340 SA3s nationwide. Half of those now, or 100, roughly half, 160 are less than 90%. But of those, 35 SA3s have coverage below 85%. So some of that information can help us to target those areas of lowest coverage rates so we can have the greatest impact or the greatest potential for impact. You can see, interestingly, those communities, they'll have very diverse cultural and linguistic and socioeconomic factors that influence their health and vaccination attitudes. The trust, access and tailored communications are really critical in those communities in particular, because national messaging often misses local needs, and there's other misinformation risks there. I won't go into any great detail with this because I know this was covered to a large extent by Alison earlier. But in terms of when we were talking before about some of those practical barriers and cost things, where it comes to not just potentially the cost of an appointment, but also the cost of driving to potentially missing work or missing a shift at work to get your kids vaccinated, and that sort of thing, quite significant. In some of the slides from the NCIS work that Alison had up, people had commented within that survey that there was about 40% of people said, appointments are expensive. Essentially, I'm kind of summarizing there. But you can see in the top right of that slide what the actual rates were in GP visits that incurred an out-of-pocket cost. So that is from some ABS data in 2024. So really a small number of GP visits where childhood vaccination services incurred that out-of-pocket cost. The majority of consultations were between 6 and 20 minutes, and cost the recipient between $20 and $65. And a further quarter of the consultations that incurred the cost were a longer appointment, greater than 20 minutes, which suggests that there were other, health services and checkups that were provided there beyond just the vaccination services. Also in the sort of the bottom right-hand corner, there's a pie chart there which talks about kind of different attitudes and different sort of measurements, if you like, of how likely people are to vaccinate. And that's just sort of one of many, I think kind of studies that's being done. It was just put there as a sort of an illustrative thing. But across the board, in round numbers, roughly, it looks like 85% of people will vaccinate their children, 5% will not, and 10% in the middle are sort of hesitant and can be convinced, essentially one way or the other. And so it's for that 10% that we really need to refine strategies to target behavioural and social barriers in particular, because that's where the opportunity is really to boost immunisation rates. I think I might have pressed the wrong button there at some point. So I was going to skip this slide because Alison was talking about it earlier, but really significant concern that when it comes to some of those numbers, that under 50% of people were prioritising childhood vaccinations. And I also would, I think, kind of mention from that earlier slide that there is some triple bulk billing incentives since they've come in. We haven't really seen the overall effect of that coming through the data either. So range of factors contributing to the loss of public trust in immunisation since the pandemic. Lots of misinformation has already been sort of mentioned today, the misinformation, disinformation with, whether that's conspiracy theories or the like, but online, people in their social media echo chambers, that's really had a disproportionate impact on vaccine hesitancy. There's concern coming through and very evident in the COVID-19 inquiry report, the lack of transparency around decisions, whether it was lockdowns, whether it was mandates, led many people to feel excluded from the process, which sort of further erodes that social license where, Australians felt a loss of autonomy, connection and freedom during the pandemic. And that has led to some resentment and scepticism towards government policies. The COVID-19 inquiry also found that there's poor communication, which damaged public trust. And in terms of compensation and transparency, that we lacked a vaccine injury compensation scheme until 2021, and it also closed in 2024. And there's been calls for a permanent, transparent system which will help to rebuild public trust. Overall, from the department's perspective, we'll be looking to do further campaign activity to promote the NIP as a trusted brand, instead of vaccine and condition-specific campaigns necessarily, so we can convey the reliability, safety and community value of vaccines across all the life stages. Huge role for all of you as health professionals in helping to rebuild that trust in immunisation. From a departmental and from a government perspective, we can make sure all the evidence-based information is online and accessible, whether that is from the department, whether it's from NCIS, and soon to be, information that'll be available from the Centre for Disease Control when that commences operations. But really, health professionals are trusted sources of health information, and the credibility of health professionals can help to counter the misinformation. For all of you to be able to have open, empathetic and non-judgmental conversations to help address concerns is critical to building understanding. And at that local level, being able to listen to individual fears and experience is really key to help restoring confidence in vaccines. Community engagement's really important because you're all well positioned to engage with culturally and linguistically diverse communities and sort of help to bridge some of those gaps in both trust and access. And you can also advocate for transparent policies and improve communication. And your involvement in the public discourse really reinforces the importance of evidence-based decision-making. We do have essentially some proposed interventions for rebuilding trust, things that we're working towards in the department. I'm not going to go through all of those things on the screen there, but definitely you can see from a national response perspective, whether it's campaigns, things that we can do. We're very interested in kind of conversations with health professionals about what additional support we can provide for providers to make sure that you've got the tools to have those conversations. And the SKAI was mentioned earlier in Alison's presentation, but also those local responses. How do we work with jurisdictions? How do we work with PHNs to provide more targeted local responses in areas of particular need? The usual activities that are underway in terms of improving childhood immunisation rates. No Jab, No Pay has been around for a while. The essential vaccine schedule, which is a performance-based payment system to jurisdictions, consistent with the responsibilities that you saw on the very first slide. We have various priority population projects underway, particularly in relation to First Nations. There's a lot of additional support that's going into those communities right now. The support tools that are available online, catch-up calculators, reminder letters at the moment. We'd love to get to something that's a bit more rapid and sort of electronic when it comes to reminders. And of course, all the campaigns that continue to run and funded by government. So in terms of the strategy itself, launched by the Minister in June, 5-year strategy to reduce vaccine preventable diseases, and particularly for priority populations like First Nations groups. The 6 areas that you can see there were mentioned earlier in Paul's slides, but essentially access, equity, trust, data, workforce, technology, and governance. They're the main areas that the strategy looks at making improvements on and provides a framework for. This is really, I think, kind of the key slide about how we operationalize that strategy through an implementation plan. So my area leads this work within the department and engaging with a number of committees, engaging with stakeholders. There's sort of 4 components to the immunisation strategy implementation plan. Firstly, and this is sort of down the left-hand side of the slide, the implementation framework, and that outlines strategic direction, governance, roles, and mechanisms. We anticipate that will be published for public consumption at the end of this calendar year. The operational plans that are there or for both the Commonwealth and the jurisdictions, they should also be published at the end of this year. Certainly, the Commonwealth's plan will be published alongside the implementation framework. I would say, just in terms of managing expectations, that at this point in time, those operational plans will largely be a stocktake of existing activities. And the reason for that is we just haven't got through the opportunity to go through budget processes and see what government wants to provide any further investment in. There's a monitoring and evaluation plan, which is key to all of this, to track progress against all the agreed indicators. That's probably going to be available in about March next year and is going to be led by the Centre for Disease Control. And then ultimately there'll be some annual public summary reports which will flow from there. There's some key advisory structures within this, and we are going through these processes effectively as we speak, down the middle of the diagram in front of you. So there's a strategic reference group to guide the direction and the implementation, and the implementation forums, which have been held to inform future investment opportunities and have that engagement with a broad range of stakeholders. The forums have been conducted in September. They were conducted by NCIS. They're actually right at that cusp at the moment of reporting to the Jurisdictional Immunisation Committee, which meets on Tuesday next week, and then to be considered by the Strategic Reference Group, which meets at the end of this coming week as well. The proposed activities from the forums were really done in relation to those priority areas of the immunisation strategy, but the role of the strategic reference group, they'll begin to assess and prioritise those recommendations, looking strategically to ultimately make recommendations of a coherent, balanced package to the department as to what they consider government should be doing in the years ahead. And some of those recommendations will be for the Australian government, some of them will be activities for jurisdictional governments to undertake. And just finally on the sort of right of the slide there, you can see there's key implementation partners to ensure strong coordination of efforts across both the Commonwealth and state and territory governments, providing different levels of agreement as needed. So targets and performance indicators will likely need to be jointly considered by health ministers, and other activities will be coordinated by health chief executives. The forums themselves, as I said, they were conducted in September. About 250 people online, 175 responses to an online survey to have additional input. Lots of consumer representatives, including from priority populations, healthcare providers, or healthcare and immunisation providers. There was local services, there was peak bodies, there's program and policy people who deliver it, but a local and state level as well, and research partners, advocates and other vaccine suppliers all participated in those forums. The information here on this slide is incredibly preliminary. And I think, as I said, the work that was done by NCIS in relation to those forums, I haven't even seen the outcomes from those yet, but it will be considered by the jurisdictional immunisation coordinators at their meeting on Tuesday next week. But across those priority areas, NCIS has been sifting those and by, thematically and by activity to what is going to provide, if you like, the greatest bang for buck in the short, medium and longer term in relation to each of those priority areas for the strategic reference group to consider as to what their recommendation will be for a package. Priority area 4 is, I think, kind of particular interest because it goes to workforce and scope of practice. Priority area 2 in relation to building trust is incredibly important as well. I think we can throw open the doors in relation to access in some ways when it comes to accessibility of vaccines. But if we haven't rebuilt some of that trust, we're still not going to have people turning up to actually get those vaccinations. And finally, somewhat, well, not quite finally maybe, but in terms of the progress to balance initiatives, some of the things that are under consideration right now are considering expanding access under the NIPVIP, that NIP vaccination in pharmacy program, potentially to include children. You probably, as you're all aware, so in South Australia, pharmacists can administer vaccines without any age restrictions. The ACT just changed theirs to 2 years and over the other day, and there's a variety of different arrangements across the country. But really important, I think, in the context that there are 6,000 pharmacies around the country who are really convenient and accessible, and particularly for children, might offer the opportunity to really boost some of those declining vaccination rates that we highlighted earlier. SMS reminders when vaccinations are due. Sounds simple. Mulaney, who's my director of the air policy, might tell you this afternoon in a panel that is considerably more difficult than it sounds right now. But being able to have something that's more immediate than getting a letter in the mail to prompt someone to make an appointment for an overdue vaccination for their child is really important. There's also other opportunities through different push notifications on different apps like the Health app or Medicare app, something like that. we're looking at what does a whole of life immunisation campaign look like. Frequently, we've seen, I think in the last few years, quite piecemeal campaigns where there'll be a little bit of money for RSV, like maternal RSV. There'll be a little bit of money for the flu ahead of high risk seasons and that sort of thing. But being able to have a campaign that's a bit more flexible that can respond to the changing arrangements that are around or changing environment in which we're operating in, as well as building trust in that NIP will be really important. There's also, I think, kind of emerging technologies. We're looking at just using AI to better track consumer sentiment, provide more tailored vaccine messaging. And there's lots of examples from around the world about some of the bots that engage with people to counter misinformation and that sort of thing. So all of those things are being explored. So what are we doing from here? The Commonwealth Action Plan, as I said, that's going to be published at the end of 2025 and updated annually, or potentially more regularly than that, depending on budget outcomes from government. The Strategic Reference Group is going to provide its advice over the course of the next couple of months on the implementation of the immunisation strategy and put forward proposals to the department and to the government. We'll go through those budget processes and ahead of the Commonwealth budget in May next year, as well as that full NIS implementation plan, and particularly with the monitoring and evaluation framework, which should be available early next year. So I hope I haven't gone over time too much, but happy to take a couple of questions.
Thank you. So we do have, thank you, David. So a bit of skepticism about just adding more providers is going to improve the numbers. So I've got a question that links the general practice, accessibility and nursing homes. Back in the late 90s, you paid $18.50 to a general practitioner if they gave a vaccine. And we got 90%, Australia was pretty proud of its 90% childhood vaccination rates. Are you providing direct incentives or people losing their accreditation in aged care homes if they're not vaccinating people and hitting those targets?
I think the thing I would say about the changes in relation to the Aged Care Act and accreditation, it's not providing the vaccine, it's making sure that the vaccine is available to the residents and that they are informed in relation to that vaccine. So anyone can choose not to take not to vaccinate, but there's no financial incentive linked there one way or the other, although it's a pretty significant financial incentive to keep your accreditation to be able to provide aged care services. But it will be about essentially making sure that the vaccine is offered and encouraged to those residents.
Do you think there's going to be a change in children's vaccines, and is the fact that the states are funding the flu mist, not the Commonwealth, of concern from where you sit?
So I think there is a lot of work to do in relation to childhood vaccines more broadly. Rates have slipped below 90% for 2-year-olds in 2002, 2003 and 2015. So we kind of need to have a look at those and sort of learn lessons from those processes. But in relation to flu mist in particular, if a product is going to be added to the National Immunisation Program, it has to go through the normal committee processes through the PBAC. The PBAC will be looking at they'll be looking at safety, efficacy and then cost effectiveness. But they need an application from the sponsor to even start to consider that.
We've got a question from over the floor.
Hi, how you going? I had one question or one query for you. If you're going to increase pharmacies or the availability of childhood vaccines at pharmacies, two things I thought of is when I've had flu vaccines there, they never make you wait the 15 minutes. So that's one thing. So are they going to actually make the children wait the 15 minutes for reactions, etc.? And the second thing is, usually when you go to the GP or you go to a health clinic for you get your immunisations, they do their yearly health checks and things like that. I'm wondering if you're going to track whether those health checks will actually be done and things may get missed.
So firstly, Yeah, I would say that expanding the NIP to include children is just something that's under consideration. It requires a decision of government, and we're not at that point at the moment. But part of that decision is not just a financial decision to pay for it. It is about the safety of the service provided, and that's going to be part of the consideration. And indeed, it's part of the consideration of jurisdictions as to whether they allow pharmacists to undertake those vaccinations for people of that age.
Thank you.
Question at the front here, David.
It's good to hear that you're doing a national immunization strategy. I've been a GP for a long time, and I just think the health department not marketing enough regarding immunization. I can see all the pharmaceutical ads regarding shingles. I've never seen a health department ad. We can reinforce your message. It's a lot easier to you get a message out. We just reinforce it. And about the child immunization for pharmacies, the GP rate is very high already. Why don't you use that money to do the marketing? Thank you.
I would love more money for marketing. And
I
for
think
campaign
GPs might
activity.
too. I'll have a last question over here. Go on. Yeah. David, answer. Yeah.
Yeah, I would love to have greater resources to be able to promote immunisation. I think that generally what we're doing is making available, evidence-based information to people through different websites, through social media campaigns. There is not a lot in mainstream media, and particularly with a lot of the vaccines that have been promoted these days, like for example, the RSV maternal vaccine. It's a more efficient and effective way to go through social media than it is for like mass media campaigns.
A question at the front here, and it'll have to be
Yeah.
our last because we've got morning tea.
Thank you. Sorry, I'm an experienced GP. I moved out from UK. I've never done immunization in UK because all the time the nurse is done. It's not a very easy job. Now, obviously, I do it myself. And how much training you're going to give this pharmacist to give a child 6 weeks old or 2 years old or 4 years old to make them confident to do the baby immunization?
Look, I think that's a really good point, and some pharmacists don't vaccinate because they don't have that level of confidence. But the educational requirements and the safety requirements will be really key to expanding that. I think Anna's here from the PSA, and she's talking after morning tea, and perhaps can give us a little bit extra information about what's included currently within the training packages to pharmacists. But of course, it will be, should the government decide to fund childhood vaccinations in pharmacies, then there will be a conversation with the PSA, who are the keepers of the, if you like, the professional practice standards for pharmacists, about what needs to be put in place to ensure the safety of those vaccinations being provided in that setting.
Thank you very much. And David's happy to take questions. So any further questions while David's here for morning tea?
I just need coffee first.
Yeah,
and
that's
I'm
right.
happy to have a conversation.
And online, if you do send questions in, we'll keep a record of them. And if we can't pass them on to people and our spokespersons for today, we'll get to them later. And that's part of our policy. So thank you to David. Thank you to everyone.